Carl, if you want to go ahead and get started, we can.
Thank you. Uh, Welcome, everyone. My name's Dr. Carl Tyler. I'm a professor of family medicine and community health at Cleveland Clinic, Lerner College of Medicine, and president of the American Academy of Developmental Medicine and Dentistry. Every third Tuesday of the month, the AADMD Student and Resident Committee hosts interdisciplinary webinars for clinicians to learn from colleagues in a patient-centered manner with the purpose of encouraging comprehensive care provision to patients with IDD. I'm turning the microphone over to Dr. Seth Keller, who helped organize today's webinar. Thank you, Seth.
Thank you very much, Carl. I am so excited. I am very excited to be here amongst friends and colleagues. And this is a special event because basically our VGR webinar today is a global event. And here's a list of our panelists, and we're going to be getting introduction to our panelists. And what I want to do is I want to set the stage for what you're about to hear and listen to in the next 45 minutes or so. Is as a background, I'm the past president of the AADMD. I'm a neurologist. And in the AADMD and other organizations, global health has been such a mainstay of really a lot of our underpinnings of conversation, because everything that we do in caring and supporting people with intellectual and developmental disabilities is really not centric to one country, another country. It's a global, international effort and issue. And really what I thought would be really fruitful for our conversation today is really bring really excellent, amazing colleagues. I don't want to butter them up too much, but you'll hear from them in a minute here from different parts of the world, including India, United Arab Emirates, and Nigeria. And you're going to be wowed. I really think you're going to be quite impressed by who they are, what they do, and why they do it. And really, point of it is really to share and contrast with each other. So the way the format of our webinar is going to be is really to ask questions. I'm going to be the moderator, and to really go back and forth between our different colleagues and really learn from them. You know, what is it they do, why they do it, and definitely for those that are on the call from different parts of the world. Also, I think you're gonna hear a lot of underpinnings that are very relevant to all of us and what we do in our daily lives. So what I'm going to do, I'm going to kind of start right here, and this is a very fluid webinar. We're going to go back and forth, and our panelists are going to introduce themselves. And so what I'll do is, and maybe I'll start with you, Akirike, from Nigeria, if that's okay with you, Dr. Wisdom. So I'm going to actually ask Dr. Wisdom, who I've gotten to know now in the last year or so, who I met him in our ADMD annual meeting, who's doing outstanding work in Nigeria. So Wisdom, I'm going to kind of ask you if you can give a basic introduction about yourself and tell the audience about who you are and the work that you're doing, if you don't mind.
Hello.
Dr.
Can you hear me?
Yes, there you are. Welcome.
Okay, thank you.
It's great
Okay,
to
thank
see
you very
you.
much, Dr. Seth,
Absolutely.
for the opportunity to speak. Okay, I'm Dr. Kirike Wisdom, the student chapter officer of the AADMD University of Nigeria, Nigeria. And I am the president of African Dental Students Association, and currently working at the National Hospital here in Nigeria. I don't know if I should, if I can share my slides now.
Yeah, why don't you, if you have some introductory slide you want to share yourself, because I would imagine, I mean, Nigeria, I've never been to Nigeria. I mean, I don't know how many people, been to Nigeria. So really learning about Nigeria, the location, and really just the proximity, I know that was something we talked about in our practice. Nigeria, I mean, oh my gosh, I'd love to hear more about it.
Yeah, Nigeria is a very beautiful country with about 250 million people. Wow. Here in Nigeria. And in fact, Nigeria is really diversified in terms of language, in terms of tribe, and in terms of ethnicity. There's a lot that goes on in here. But with AADMD, I think we are moving forward, and we have we are growing in so many climes, in so many areas, from the University of Nigeria and also in the University of Lagos, where my friend Anthony have also been able to set up the AADMD student chapter there in the University of Lagos. Can I be able to share my slides now, please?
Yeah, I think go ahead if you can, right? Courtney, can you share? We can share, right? Let's see what you have to show. I think we got some visuals. And what we'll do, Okirike, just to kind of mention, really just give some introduction about yourself, a little bit of your work, and then I'm going to flip over to our other colleagues who are also, I want them to give some information about themselves, okay? Are you able to?
Okay.
You should be able to share.
There you go. It's coming up.
Can you see my screen?
It's starting to show. Yep.
Okay. As I
Yeah,
said
and
earlier,
yeah,
I
go ahead.
am
And I
Wisdom
think the one thing,
Okirika, and
go ahead, Courtney.
hello, can you hear me?
Yes, go ahead.
Okay, and you can see my slide, and
Not quite, not quite yet, not quite. If you wanted to maybe start talking about it, yeah, we got it. Yes, 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 yes.
oh, slide. So this is us in Nigeria, and this is the map of Nigeria. My AADMD journey, as you asked earlier, started with Alliance for Oral Health Across Borders. Personally, I have always had the passion to reach out to people, especially with people with neurodevelopmental disabilities. But here in Nigeria, we say special needs, even as a university undergraduate. There is no face behind it. There's no definition behind it. We just say special needs. And we don't really know these people. I've seen a lot of people living with neurodevelopmental disabilities, as the case may be. But we don't really understand how to reach out to them up until the time I was able to attend the One Voice conference of the AADMD, American Academy for Developmental Medicine and Dentistry. And that was where my journey began. Because being there, I met a lot of people. I saw people living with neurodevelopmental disabilities where they lead their normal life. And I was thrilled. I was excited at the same time. And I know that this is my calling. This has always been my passion. And I felt so sad because in our country, Nigeria, there's a lot that we are really missing out, starting from the professionals, from the students, including the people living with neurodevelopmental disabilities, because there's a lot of perception. Now, what we are doing, as the case may be, we've been able to, because when I came back from the One Voice conference, after we've been given a go ahead for us to establish AADMD University of Nigeria student chapter, I felt that people that will join me in this journey, people that will join us, are people that really understand what neurodevelopmental disabilities is all about, people that have the same passion just like myself. And I do not want to just gather people, let them just come in. I reached out to one of our professors, the student, the Associate Dean Student Affairs of the University of Nigeria College of Medicine, who is a professor of pediatrics. And he keyed into the vision of AADMD. And we released an application for people to apply, free application, so that we read their personal letters. It will interest you that we got a lot of people that have brothers or sisters living with neurodevelopmental disabilities. I wish there would be an opportunity for you guys, for all of you to even read this story. The story was really quite thrilling, quite touching, because there and then, you understand the diversity in Nigeria, how Nigeria perceive health, and how Nigeria also perceive people living with one disabilities or another. It will interest you that some people always relate it to religion. They call them some names like Obanje, They say these people, Obanje, that's more like somebody that have been infected with evil spirit and what have you. So I think I should stop here now. Thank you very much.
Okay, okay. I mean, that's really wonderful. And really what you're going to hear from each of the speakers, their different perspective, not only in the country for which you're talking about, but you're going to really hear about the differences in where they're coming from. So Sujoy, I'm actually going to jump to you. So this is like a global visit here. So we're traveling out of Africa, and now we're going to go to India. So Sujoy, I'm going to ask you a similar question, and certainly we'll let you to bring up your slides, and Okirike, we'll get back to you, and I appreciate your introduction. And really India, and really the work that you're doing in India, Sujoy, is certainly different. So if you can give a little introduction, Sujoy, about yourself, and I want our colleagues listening and who are also panelists to learn about you, and almost like beginning a journey, almost like the way Okirike was able to describe on how he got to meet us. And maybe you can kind of give our colleagues a little opening discussion about yourself.
Thank you, Shet. So good morning, good afternoon, good evening to all of my friends, those who have joined this meeting today. And I'm thankful to AADMD to give me opportunity to join and speak about our work in India. So I am Dr. Sujoy Ghosh. I'm basically geneticist, an academician and researcher in the field of intellectual disability. Particularly, my focused area is Down syndrome. But gradually, we have expanded our wing to include more and more other types of intellectual disability as well, particularly for autism spectral disorder. So I am working in city of Kolkata and the easternmost part of the India. And as you know that India is a vast country having 1.5 billion populations, with different kinds of ethnicity, religious practices, language, lifestyle, and demographic variability. So the disease clinical presentation of the different kind of intellectual disability is absolutely different from the different parts of the country. And I have been supported and collaborated by some of my physician friends and collaborator. One of them, Dr. Jashodhara Roy Chaudhary, is here today with me to any kind of the answer beside myself. So with these few words regarding my introduction of the work, if you allow me, then I can share my slides and presentation.
Why don't you go ahead, Sujoy?
Okay, thank you.
Yeah, let's hear about your story. Tell us about you and a little bit about your work. That would be great.
Well, is it visible to all of you? Okay, so I am here in the global map. Possibly all of you can see it. India is, okay, I'm just taking the larger versions of the, okay. So here is my city, city of Kolkata. It was once it was a capital of British colony in the India and Southeast Asia, and it is popularly known as a cultural cultural capital of India. So these are some iconic building of city of Kolkata for my friends across the world, and some notable Nobel laureate personality, all of them from city of Kolkata, taking from Rabindranath Tagore, won Nobel Prize in Literature, then Mother Teresa, a Nobel in Peace, C.V. Raman, Nobel in Physics, Ronald Ross, Nobel in Physiology and Medicine for his discovery on malaria parasite, Amartya Sen and Abhijit Binayak Chaudhary for their Nobel laureate in economics, and Satyajit Ray, the Oscar winner filmmaker. So we started working with Down syndrome from the year of 2001. Our aim was to unravel the causes and consequences of trisomy 21 genetic condition. We gradually included family to constitute a study cohort. Our clinician collaborator referred the cases to our laboratory following clinical examinations and testing for health conditions. So initial phase and gradual progress that we made in nutshell, we started, so we request the families for participation in our study by sharing their epidemiological detail and donating their tissue sample. We analyze the genome of persons with Down syndrome and also their mother as possible. We share the outcome with the families in local languages and provide advocacy and counseling for greater clinical management of the cases. Our clinician collaborator, Dr. Sumantra Sarkar, Sumantra actually joined the last rehearsal meeting in the last week, Dr. Sharkar has opened up a dedicated Down syndrome clinic at State-Aided Hospital, which is the first such clinic in the country. So major findings from our team in nutshell: identification of population-specific genetic and epidemiological factors that influence the clinical presentation of co-occurring conditions such as congenital heart defect, cognitive decline, Alzheimer's disease, leukemia, and obstructive sleep apnea in Down syndrome. And we also remarkably have found and reported that mothers of individuals with Down syndrome also suffer from accelerated aging, and they are suffering from high risk of Alzheimer's disease in the latter part of their life. Our initiative in the COVID-19 pandemic was very remarkable and popularized and highlighted by international and national media. We started online survey on COVID-19 infection as a part of the global community in the families having individual with Down syndrome, and found that risk of infection and mortality nearly 5 times greater than general population. The clinical presentation and COVID-19 infection manifestations were different in Indian from high-income countries like USA and UK. We took a lead role to recommend the Indian government to include intellectual disability as a priority group for COVID-19 vaccination. We started immune response following vaccinations and found people with intellectual disability may suffer from rapid decline in antibody titer, so extra booster dose is needed for them. We sent this recommendation to World Health Organization, and we also analyzed that psychosocial impact on the Indian families having members with all kinds of intellectual disability. So these are some of our scientific publications on this, our work. This all actually is a global community. As a part of this global community, we have participated in this kind of studies. So current phase of work, currently we are now participating in the global study. We are collaborating with National Institute of Health for comparative cohort study on the Down syndrome from various countries. We have now joined the global initiative of Down syndrome biobanking. We are now collaborating with Alzheimer biomarker consortiums from Down syndrome, shortly known as ABCDS. We are now searching indigenous medicine from ancient Indian Ayurvedic formulations for cognitive decline in all kinds of intellectual disability. We organize regular charitable healthcare clinic for the Down syndrome and autism spectral disorder, particularly from economically weaker section of our society. But there are a lot of challenges and limitations. In short, these are social stigmatizations, poor understanding of causes of ID. The subject ID is not included in the national syllabus or curriculum of bachelor or master's courses in the clinical study that is popularly known as MBBS. MBBS is the bachelor study for the clinicians and MD is the master study for clinician in India. Most of the clinicians considered ID is less profitable than other discipline to be practiced. Government of India has specific policies for ID, but there is lack of monitoring in implementation, less budgetary allotment for ID than other health issues, poor grant support to the research initiative related to ID, owing to less priority by the government, and inadequate handholding between science and society. These are some of the limitations. Our future target to develop a dedicated clinic for ID healthcare treatment and management in the city of Kolkata, India, to continue in research to find out the country and society specific genetic and epidemiological risk factor associated with co-occurring conditions of IDs, to develop a support system for families having members with IDs that will cater social and legal needs related to IDs. So with these few slides, I can conclude, but if you permit, I can share one audio visual that we made particularly on our COVID-19 vaccination drive, because we are the first to organize such dedicated COVID-19 vaccination clinic in the country like India. And this audio visual just 1 minute long. If you allow, I can share this
So
audio.
why don't you do that? So Joy, why don't you go ahead and do that? Because we're then going to move on to Shadi too. So why don't you go ahead and show that? Because then we're going to go back and forth amongst all of our colleagues and dig in and really present a lot of what you're talking about in more detail. So why don't you go ahead?
Okay, thank you.
Yeah, we just have to make sure the audio, Courtney wants to see and make sure we can all hear the audio. Is there an audio to it, Sujoy?
Yeah, it is with audio.
You just have to make sure that when you share your screen, you click share your audio as well.
Okay. Is it visible?
You might want to exit out and go back in. Is that what you should do, Courtney? Exit out and go back in?
Yeah, I'm going to stop your sharing. Go ahead and share just that video.
Okay.
Right, and then you have to enable the audio with it. I think that'll work. Yeah, yeah. Oh, there you go.
Is it visible now? Just let me know whether it is visible and
No,
audible.
it is not.
Now,
I think you're sharing your file window instead of the actual video itself.
Right. If you put that down, and we can, maybe it's behind it. If you could.
So I'm going to stop your sharing and let's try this one more time. Try to share the video
Yeah, as you're
window.
doing that, I mean, basically, it's amazing, Sujoy, as I'm listening to so much of your conversation, there's so much similarity. I'm sure our other colleague will talk about it, about what you're doing and really all the things that you are trying to overcome within your own country, on how so many similarity there are about, each of us in our own country and culture about overcoming.
yeah, there are a lot of differences, but there are some of the similarities in the ID, their causes. But if you go to the different corner of the country, if you take sample from the western part of the India and eastern part of the India, there is a lot of differences. Maybe due to the ethnicity and epidemiological exposures that are different for these groups. And also from the north and south, there's a vast distances between the places, and that pose a lot of differences in the manifestation.
Very good. Yeah, maybe we'll have to try the video later. So I apologize, Sujoy. I'm going to actually go to Shadi, okay? Yeah, I think let's do that. Because just in the interest of time, I apologize. I think we're going to have to kind of move on, if that's okay. Maybe at the end, if we can have time for your COVID video.
Okay, sure.
Let's do that. I apologize. So Shadi, I'm actually going to bring you on, and basically, now we're actually traveling. So you think of yourselves on their world map. We're now going to the United Arab Emirates, and basically. Special care dentistry. I know that Shadi, you're gonna talk about your life, what you do. So if we can X out for Sujoy, and we could move ourselves over and now talk to Shadi, you can give us a story about yourself and the work you do, and maybe you'll see some of the similarities to both what Okirike and what Sujoy talked about. So you there, Shadi? We can kind of bring you on. There you are. Hello. Good to see you from the United Arab. So tell you, who's this guy from the United Arab Emirates? Hello.
Thank you, Seth. Thank you very much for the invitation. And it's truly a pleasure to be here. So basically, I'm Shadi Al-Khatib, Palestinian Belgian who studied in Belgium, special needs dentistry, and moved to UAE. And I'm a lecturer at the University of Sharjah. I teach special needs dentistry. And I'm the founder of and faculty advisor of the American Academy of Developmental Medicine and Dentistry. We call it University of Sharjah Student Chapter. It's the first, it's unique in the Middle East. I will touch base during my presentation about some of the achievements and opportunities that we had here. So allow me first to share my presentation.
Go right ahead. Go right ahead. Yeah, and it's really the University of Sharjah, as myself at ADMD, working with the University of Sharjah and the other students. So it's thrilled. So we're so thrilled to have you here.
Thank you very much. How to put it on display mode? Give me a second.
Mm-hmm.
Okay. Yeah. So can you see my presentation?
Absolutely. Go right ahead.
So thank you very much. Yes. So my presentation is about intellectual and developmental disabilities, care, challenges, and possibilities for the new healthcare providers here in UAE. So I became a special needs dentist after doing a rotation in hospital dentistry in Leuven, Belgium. And interestingly, the gap in integrated dental care in the inpatient setting was astounding and had unfortunately very little highlight in anyone's horizon. Then moving and coming to the UAE, the field of special needs was something scarce. There were very few specialized dentists in the matter, and patients were between GPs, and as needed specialists, but with a very far off concept of how to manage special needs patients, from the medical complex cases to the behavioral conditions. So I was actually surprised to know that I was among the very few first trained and specialized special needs dentists here in the UAE. And honestly, this field drew a lot of attention when the Special Olympics MENA Games took place here in UAE, and it was in 2018. It was a major groundbreaker on the field. Everything started to blossom from there. Professor Alan Wong, who I proudly call a friend, was the leading and point man who illuminated the path on special care dentistry for us here, mainly for this event, and of course, along with the pioneer of the Special Smiles Initiate, Professor Steve Perlman, and two beacons who truly ignited a change in the region. Now, today I'm going to highlight the current progress we have made in special care dentistry in UAE. I will also highlight the unique challenges in treating these patients with multiple factors. And finally, I humbly will state the advancement that we have made and future forward plans we have for them. So it started with the Special Olympics. It snowballed a plethora of focus and training on special needs. And we had international specialists come in and from the globe. A lot of them thankfully came from the States. They trained. We had two major events hosted at the University of Sharjah, organized by the ADMD here, the local team. They trained new specialists on the agenda of the program special needs, and actually that led further interest in the potential of the healthcare of the healthy athletes. Now, we all know that Wayne Dyer, who said, if you change the way you look at things, the things you look at change. So the concept here is patients first. Hospitals followed accreditation by acknowledgement as a unified healthcare center. This distinction showcases the healthcare bodies of the United Arab Emirates government and commitment to offering exceptional oral and dental care services to individuals with special needs. Here, programs actually we're trying to encourage are oral rehabilitations under either nitrous or general anesthesia. We try to prioritizing safety and well-being of our IDD patients, access to healthcare, and ensuring equitable healthcare for individuals with intellectual and developmental disabilities. Many challenges and we face, of course, and as my two colleagues previously mentioned, thankfully mentioned, the challenges fall into a few aspects actually. So drivers of special care dentistry in the aftermath of consanguineous marriages. However, this noticeably is alleviating currently. Fortunately, the form of passion is not something you would run short here in the UAE. The people are strong advocates for equal health care, and it's embedded into the moral of top officials in pushing this further and through. Legislative matters have rarely been a concern here, as the leaders of the country have been the strongest voices and leaders, thankfully, in paving the way for the people of determination. Now, there are some corporate policies in the inclusion of special care dentistry into the systemic healthcare, and that actually which proved to be a challenge. However, even earlier in some hospital, there were policies like what we call ABSHIR, but it was not comprehensive enough for the special ones. And also dental knowledge of complex medical cases and hospital dentistry was actually limited to governmental hospitals and included some dental services or very, very few private hospitals. Let me talk about a few and highlight few challenges. Now, we all know that treating patients with special needs in the Arab world generally, and especially and in United Arab Emirates, present unique challenges, and that is due to various either cultural or societal and infrastructural factors. And here I sum up some key points trying to highlight some of these challenges. Actually, we have limited awareness and accessibility, and not everyone among the healthcare professionals or the caregivers are very well aware regarding the specific needs of patients with disabilities. Another thing is a stigma and discrimination, and there may be prevalent societal stigma and discrimination. Here in UAE, we have over 10 million people living, and that actually can make it a little bit difficult for them to access dental services without facing some social barriers. Another factor is infrastructure and facilities. Unfortunately, in the Arab world in general, and in UAE also, not all dental clinics, dental settings are equipped with all the necessary facilities and accommodations for people, for example, on wheelchairs or people with sensory impairments, to accommodate them. Another is a communication barrier, and language can be a serious barrier in treating and accommodating these patients. Also, cultural sensitivities. It's a factor, and actually healthcare providers, frankly speaking, need to be culturally competent and sensitive to all these cultural sensitivities, limited training and educational. It's a very broad term. We started here at our university to include special needs dentistry in our curriculum in the undergrads and in the postgrads, but still it's still a challenge actually to implement this in all other universities. There are some financial constraints. We have legal and regulatory frameworks in some Arabic countries that can also pose challenges in treating these patients. Family dynamics and support is another factor, or holistic approach to care, where dental treatment for patients with special needs, it actually requires a holistic approach, and not only it considers not only for their oral health, but also for the entire body and overall well-being and quality of life. I'm going to stop here, and in the second part, I'll be talking about the achievements we have here with the AADMD and what we have accomplished here in UAE.
Shadi, that's perfect timing. I think that's really great, and really, I mean, it's just not to be funny about it. It's just how many similarities there are about what each of us is doing. And Okirike Wisdom, I'm going to actually pull you back in. You know, I thank you very much for giving your brief introduction. Now you've had time to listen to, you know, our colleague in India and United Arab Emirates and hearing their perspective. So I you know, certainly your own perspective. I mean, Africa, Nigeria, culture, where your country is starting at. So if you maybe want to just talk about maybe where things are generally in Nigeria, and then then pivot to future trends, and then we can go back to our other colleagues and talk about next steps. So Okirike, if you want, we'll open up your microphone and bring you on, and we can then go with that. But definitely, you know, you'll see that there's so much similarities, I imagine, or maybe not. Maybe things are different in Nigeria from other countries. Yeah, there you go. Hello. I hear you. I don't hear you. I see you. Let's see. We get okay. Oh, I see you're talking. I don't hear you yet.
Can you hear me now?
Yes. So let's
Okay,
let's
thank
see
you
if
very
we
much.
can
Can you see my slide?
no. If we can cancel out Shadi's slides. So Courtney, if you can help or give some direction. We can stop sharing. So Kirike, as we're trying to work, there
Okay,
you
good.
go.
So
So
can
go
you hear
ahead.
me now?
Yes.
So you know, I gave a very brief introduction before.
Yes.
So, and I wanted others to speak. But there are so many things that is happening in Nigeria as far as IDD is concerned, of which it seems like there are lots and lots of similarities with a neurodevelopmental
I'm sorry,
disability.
Kirike, are there slides to open up? I'm just seeing a list of files. I'm not seeing a presentation. I don't know if you want to show something right now.
Can you see it now?
No, I cannot. Yeah, this is a fluid thing we're doing from all around the world. We're kind of
Okay. So let me just continue while my technical director works on the slide.
Oh, go
So
ahead.
one of the problems that we have, one of the challenge that we have, and this is actually one of the things I most appreciate AADMD about, is the part of healthcare professionals. Because the challenges we have in terms of healthcare for people living with neurodevelopmental disability. Okay. You can see it now, right?
Yes. Yep.
Good. So coming back to Nigeria from AADMD One Voice Conference, there are lots and lots of things we understood. There are lots and lots of things to take back home, because now Nigeria is the first place that we are having AADMD student chapter in Africa. So Nigeria is more or less like forming like a prototype for every other AADMD chapter that will eventually come after us, that is in Africa. Going back to Africa, there's a lot. I want to pick one of the major challenge that we have, and that is the perception and the understanding amongst the healthcare professionals and the students. Most of the healthcare professionals, they do not really understand the neurodevelopmental disability, what it entails. And most people that eventually get to know about it, I could remember when we were about to start up the student chapter here in Nigeria, I reached out to a professor and I spoke to a professor about AADMD. This is one of the challenge. And the professor was telling me that, oh, we are not done with people, with normal people. We are not done with caring for the normal people. Talk more of caring for people with neurodevelopmental disability. Now you can imagine this is coming from not just a healthcare professional, a professor in the field of medicine. This is one of the problems and the challenge we have in Africa, because most times people eventually get to learn about neurodevelopmental disability when they are already working or when they are already specialists. Maybe when they get into neurology, pediatrics, and what have you. So I must appreciate AADMD for having the mindset to create student chapter, because now what we are doing now is we've already been able to get students in the healthcare profession, like in dentistry, in medicine, to be the student chapters here in Nigeria. And as I said earlier, you can imagine their dreams and their passion to be able to care for the people living with neurodevelopmental disabilities. And we were also very strategic to reaching out to, very, very high standing personalities in the College of Medicine, because I said earlier, we have the Associate Dean Student Affairs of the College of Medicine as one of our staff advisor, and he's a professor of pediatrics, and he's doing extremely well. Remember, the other day, we also have a chapter meeting where we invited one of our professors in neurology. And one of the challenges that I also found out was that we don't even have a register. We don't have a register. We don't have a documentation of people living with neurodevelopmental disabilities in Nigeria. And that is a challenge. And these are because when we get to know the challenges, we can now be able to know how to address these challenges. We do not have a register to be able to say, okay. And another thing, because Nigeria, as I said, is made up of 250 million people. 250 million, over 250 million, not just 250 million. And there are about 36 states in Nigeria with a capital is making it 37, the FCT capital. And this state is more like a country in one. It's more like having 36 or 37 countries in one country. And there are so many distance between one state and another. So the languages, and in Nigeria, we have the South, we have the West, we have the East, we have the North. These places have different languages. We have different cultures, we have different religion. And the problems we have as a country, the problems we have in caring for people with neurodevelopmental disabilities and even other health issues we have is because there's a way these factors of language, of religion, of culture plays a role. They all come together to face us as a challenge in caring for people with neurodevelopmental disabilities. As I said earlier, in some places in Nigeria, you get to realize that they always have a way of tying health issues to religion. They always have a way of tying, then talk more of neurodevelopmental disabilities. They have a way of tying it to evil spirits. And we as the student chapter, we are now rising to the standard of trying to educate the public, trying to talk to people that this is actually a health challenge. It's a health problem. It is not evil spirits. There is no devil anywhere fighting people. So these are some of the things that plays a role. Even the languages, because now we are going to villages. Because of our people, like the student chapter that we have already been able to form, we are now going to the villages, speaking to them in the language that they can understand. And thanks to AADMD, because we have people that have relatives, that have brothers and sisters with Down syndrome, with autism, and we even by reading their story, their personal stories, why they were applying to become members of AADMD student chapter here in Nigeria, you can relate to the understanding, to the perception, to what they as the relatives are facing, more than what the people living. Then you can now imagine, if the relatives are facing these problems, what about the people they call people living with neurodevelopmental disabilities? Honestly, I would say that AADMD have really opened our eyes. It has really opened the students' eyes. A lot of people are even getting more engaged, because in the AADMD chapter meeting that we had the last time that we've been having, there's a lot of things, like there's a lot of word that went across, and I can the feeling and the passion is really palpable.
Dr. Wisdom, I apologize. Can I just ask you a question? I mean, I'm just so enthralled by what you're saying, and it's really the effort of advocacy. I mean, you're really talking about going out and talking to the people. What's your sense so far in the beginning of interacting with those with disabilities and their families? What has been your experience so far in what you've seen in Nigeria?
One of the major things that we've seen is that stigma, and people are not even trying to be really open to healthcare, because one of the problems we've also seen is that a lot of organizations, a lot of people play politics with people with neurodevelopmental disabilities. Sometimes you see people rising up to, we want to do this. You see governments giving stories, giving promises. We want to do this and that. Maybe someone that wants to run for a position in the government can come out and be like, pretend to care.
Really?
And because they
Right.
pretend to care, and because of that, even when the genuine people now come to care, just like AADMD here in Nigeria, we have to face a whole lot of protocols. Because as I'm talking to you now, we were supposed to have an outreach in Enugu, that is coming from the University of Nigeria student chapter. But we were not really given that free hand to be able to interact with these people until we wrote a letter from our staff advisors, and we are extending it to them. And I believe that the outreach is going to take place by next month. It ought to have taken place since January, February, but they are not open because a lot of people just come out there, take pictures, pretend to care, give a lot of promises, and they don't come back.
Really? Yeah, you're talking like truth to power. I think we're going to hear that amongst our other colleagues about, we can do things that looks good and feels good, but does it really matter? Are you doing it for the right reasons? Does it really matter? So Kiriki, do me a favor, talk somewhat about the next steps, and then we only have about 10 minutes or so left in our whole prior presentation. So go ahead. If you can talk about this, and we'll go through this, and then I'm going to bring on our other two colleagues, and we're going to quickly go ask them some similar questions. So if you can go through this.
Thank you very much. Honestly, I wish I can keep talking and talk more, but
well, I wish
for
you
the
could
want of
too.
time,
I wish you could.
for the want
I
of time, I will just talk about some of the things that we are planning, because there's a lot. We want future international collaboration. My stepping out from Nigeria to attend the One Voice conference in America really opened my eyes, and I have been able to bring this back to Nigeria, and we've been able to establish a chapter. So moving on from here, we are looking forward to more international collaboration, to more research. And we are also, because we understood that we need to understand the need, what the AADMD, like what the neurodevelopmental disabilities, what the people living with neurodevelopmental disabilities really need. So one, we're already planning an outreach. We have already extended a handshake to, people that are in government. People that are in government, to really understand that, oh, this is a different body, this is a different organization. We are trying to, because one of the things that works here in Nigeria is you need that awareness. You need, and most of the times, it's always the government that gives you that backing. So with our university, because I said earlier, we were very strategic in getting people that really matter in the university to be staff advisors in our organization. And they are helping us. They've been able to reach out to the provost of the College of Medicine to, notify the provost that, oh, there's an AADMD student chapter in the university. And we are getting support both by encouragement, to move more. We have one of our very, very outstanding professors talking to us the other day, Professor Ikenna Onwekwe, who is a neurologist. So we are also looking at research works, because our the members of our chapter, they are very much interested in research. A lot of them have already started extending to me. We want to do this, we want to do that. We are also looking at working on a comparative study within Nigeria and the US, which I think we are also looking at doing it with the university, the fellow university in New York, so that we can compare and contrast, the knowledge, attitude, and practices of students as it regards neurodevelopmental disabilities. One thing that has been my dream, because it's looking like a way too much of a dream, but it's good to dream. I heard last year when Professor Trollo Julian was talking about that they were able to build a
Julian was our colleague
neurodevelopmental
from
disability.
Australia, Julian Troller.
Yes, Australia.
Yeah,
yes,
absolutely.
that
Yeah, go ahead.
he was able to move a motion or propose for a neurodevelopmental disability specialist hospital to be built in Australia. I made it a dream, and I have been able to speak to my students, like the chapter here in Nigeria. We will make sure that the awareness keep flowing. We make sure that we keep increasing the knowledge, the information about neurodevelopmental disabilities. Who knows? hopefully in the nearest years to come, a neurodevelopmental disability specialist hospital will be constructed in Nigeria. It's a dream, and I believe it. And not just a neurodevelopmental disability hospital, a neurodevelopmental disability specialist hospital and a research center.
Well, you're very, I mean,
Thank you
gosh,
very
your
much.
passion is so obvious, you know, what you're really doing. And basically, invite me and every colleague to be there. I think we all want to come to help you with them. And basically, what I want to do, we really only have a little more time, Okirike. So, what I'm going to do, if that's okay, I really apologize, but let's open this up to Sujoy and Shadi also, okay? And what I want to do, and let's, if we can actually close this right now for Okirike, and let's open this up. So if you could open up your, and let's look at Shadi and also Sujoy. And Sujoy, I'm just going to ask you a question. And this is really, you know, feeding back on advocacy and also next steps. So if you can also, oh, there's my picture. Oh my God, that's cool. There you go. Thank you. You're so kind. Anyway, so Sujoy, if you could also talk also, let's kind of go on to the enthusiasm, the work, and all the issue about advocacy. And maybe you could kind of maybe pivot a question to that, Sujoy, and maybe the next step. If you can briefly maybe give some information, Sujoy.
Yeah. So our immediate next steps definitely to raise the concern among the families, among the doctors, and definitely among the policymakers. That is a big thing, because whatever we are doing, if it would not be supported by the policymaker, by making laws or by providing financial support, we cannot do anything big, anything great for the people with neurodevelopmental disabilities. So the first work is to raise the concern. We are actually started advocacy, and definitely we are going for different level of talking, sharing our thoughts, conferences, seminars. We are meeting regularly with the families, having that kind of the patients and also the clinicians. As I mentioned in my slides, there is a problem even from the clinician end, because a part of the clinician from our country, they also consider this kind of the people as a burden, social burden, and they are not at all optimistic for their recovery. And most of the cases, this group of clinicians, they suggest the parents not to give much care to them, and they suggest for the next issue, next child for their life and support and families. So that is something very gray area to be discussed, but we are optimistic, and we know that this kind of support from AADMD and global community, our networking, our sharing of the thought and global support could bring more light in the life of this kind of families, and we can do something very significant in our country. And I am hopeful that AADMD Indian chapter will, in cooperations and collaborations with this global community, make some significant changes in this attitude and concern regarding IDs in India.
I love it. Yeah, I mean, basically, I mean, the history of the United States is really not so many far off from really Nigeria or India or UAE. We're all on a spectrum. All of us in our world, in our culture, are living amongst a spectrum of where we were, where we're at, and where we're going to go. But it's really the shared humanity which connects us. So I think that we can all agree on that. We do. So Shadi, basically, same kind of question that I'm asking our colleagues, where things need to go and your own thought, and you kind of alluded a lot to this already about the cultural nature of your own country in UAE and overcoming, because you have to care yourself about your own loved one, your family member, to believe they deserve a better life and are citizens, equal citizens. There, I do see your slide. Are you there, Shadi?
Yes, can you hear me now?
Yeah, absolutely. Go ahead, Shadi. If you want to just explain or talk about it, that'd be okay too.
Yeah,
we only have a few more minutes left.
Yeah, okay. I want to show you what we actually, how far we accomplished.
Because you've been doing this for a few years, haven't you, Shadi? You've been at
Yes,
this?
we have been doing this in since 2018 actually. So thank you. First, I want to say that there are a lot of parallels between all us and from Nigeria, India, here in the Arab world. And it's so interesting to see how each country actually overcomes these challenges. Let me share with you quickly in few slides and the achievements that the American Academy of Developmental Medicine and Dentistry, University of Sharjah in UAE have been doing, and it's actually incredible and at a warp speed. And of these most notable achievements, actually, we have some accredited dental centers for special care dentistry. We have multidisciplinary incorporation in universities on special care dentistry and other allied healthcare fields. We established special care dentistry dental clinic at the University of Sharjah. It's a free of charge, and the waiting list is huge, actually. We have increased trying, and then we have increased public awareness through campaigns and missions, and with the mobile dental van to treat people of determination. We have weekly visits to multiple centers, especially in the rural areas. We have we actually partners with multiple centers here in UAE, among them the Emirates Down Syndrome Association, Autism Center in Dubai and in Sharjah, and the Emirates Congenital Heart Disease Associations, and as it among many other associations and centers. And we have active webinars for dentists and with parents and caregivers and other allied healthcare to teach, to be part of them. Here, allow me to introduce the excellent, the enthusiastic team and young dentists and doctors and among other among others, and some of the missions that we participated, took part in, to improve oral hygiene and to raise awareness. So now, what is the future plan of special care dentistry in UAE? We need to start understanding the situation of special care dentistry in UAE and in surrounding Arab countries. And you know, as the UAE is a melting pot of inclusivity, there is a diverse array of IDD and people of determination, and we need actually to understand, and we need to know the scope. So that's the first step, understanding. Second, the next step is in educative form. We need to continue raising awareness among the dental community, the medical community, the general public, and patients and healthcare and caregivers, and that is through research, conferences, lectures, and all. Important also to introduce special care dentistry into the undergraduate and postgraduate curriculum in all the Arab dental schools, and with an idea to build a future for special care dental experts in this field. Also, all dentists support all people with disability. And that's actually, like now, that's what we are doing, networking in order to support them and to exchange ideas and expertise. And finally, develop clinical guide to practice special care dentistry in the Arab world, with an idea of every dentist becomes a special care dentist. Basically are the points I've sum up. And I would like to hear from my other fellow colleagues how they tackle these challenges and what accomplishments they have made.
Thank you, Shadi. Yeah, I mean, my goodness, I'm blown away. I mean, whenever we put all these presentations together, but I'm honored. I'm actually honored to be amongst, my global colleagues and friends. And I really wish I know that each of you could speak forever and really bring you all together. I guess it was pretty ambitious because there's so much wonderful things to talk about. But unfortunately, it's at the end of our time. We're actually out of time. Courtney Frey, I mean, is there any closing remarks? I apologize about our time, but we did a great conversation, and thank you to our colleagues and friends. So just to finish up, were there any questions? We can maybe post them, and maybe we can get back to you. Neha Mehta, she's our VGR coordinator, who's been really instrumental amongst my AD&B colleagues in helping put this together. Thank you also very much for this around the world. And we definitely in the AD&B, and you've heard the AD&B name mentioned quite a number of times, we're going to be around and we're going to be basically reaching out to everyone. We have an upcoming conference you can see by the name here in Chicago coming up in June. And we invite everyone to go to our website and thank you for the information. This is a world issue and world event, advocacy, person-centered effort, and everyone can make a difference. And I think you all know that, and everyone can make a difference. Thank you.
All right. Thanks, everyone. Have a great day.
Thank you, folks. Thanks again.
Thank you.